In health news tonight, we're learning a lot more about just how much diet can impact the risk of developing cancer. Researchers have long known that carbohydrates fuel tumor growth, but the BC Cancer Agency is the first to study whether or not altering carb intake can actually reduce your cancer risk. And Linda Aylesworth has more on the promising results.
Few diseases get as much attention or research funding as cancer. So many avenues to be explored. Among them, the link between carbohydrates and tumor growth.
It's been known for a long time that cancer cells depend a lot more on glucose, and which is what is broken down from carbohydrates.
So we asked a very simple question. By simply changing the diet to a low-carb diet, can we reduce blood glucose levels sufficiently to have an impact on cancer cell growth?
What a wonderful thought, that we could prevent or even treat cancer with diet. A couple of years ago, Dr. Jerry Crystal and PhD student Victor Ho, both researchers at the BC Cancer Agency, got to work.
We have a group of mice that are predisposed to breast cancer, and we split the group into two. For one group, we fed them a normal sort of Western-style diet, which is high in carb, 55% roughly.
And 23% of their diet was composed of protein. For the other group of mice, the percentages were basically switched, producing a low carbohydrate diet. The results?
7 out of the 10 mice on the normal diet developed cancer throughout the 2 years, which is about the normal ratio you would expect. But the mice on the low-carb diet, these same mice, just put on a low-carb diet, only 3 out of 11 of them developed cancer. That's more than a 50% decrease.
Another finding, the low-carb mice stayed fit and trim. The Western diet mice, not so much. The researchers were so impressed, they went on the diet.
I lost about probably 10 pounds.
I've noticed my waist size has gone down substantially.
They did it by increasing their protein intake and cutting back on carbohydrates like bread, pasta, rice, potatoes, cereal, and of course, sugary treats.
Stop drinking regular pop, which is just 10.5 teaspoons of sugar, and stop drinking fruit juices.
And when combined with certain non-steroidal anti-inflammatory drugs, the diet reduced the spread of existing tumors in mice. But all this promising news comes with a warning.
Anyone who's listening to this who has metastatic disease, don't say, okay, I'm not going to eat anything with sugar in it.
That's because weight loss is dangerous when fighting cancer. Instead, Dr. Crystal advises increasing protein instead. While this study was conducted with mice, it's hoped future studies will show similar anti-cancer benefits in humans.
And of course, you should talk to your doctor if you're considering changing your diet. And we should let you know that researchers say rather than eating more meat, you can increase protein intake by using whey powder isolate. That's a byproduct of milk that can be found in most supermarkets and drugstores. And you can find more information on our website under links in the news.